Hi, it's Dr. Parikh with Region Medical, and today I wanted to talk about the differences between prolotherapy and PRP, which are two common regenerative treatments that are out there. Now I'll start with PRP because PRP seems to be much more common and growing in knowledge. Now PRP is taking your blood, spinning it down in a centrifuge, and concentrating it out so that the concentration of platelets is much higher than the baseline. Now, there are different types of PRP that are made. There are so many different companies that are out there. So one of the things that you really need to look at is what is the process of making that PRP? If someone's saying, okay, we can do PRP, and they're coming at and getting blood in a little blood vial like you would when you went to a lab and gave blood, that's not going to give you good quality PRP. You're not going to get that increase in platelets. And that's not really going to get you the treatment that you need. Generally, you need 60 to even 120 or more cc's of blood to get a good concentrated PRP sample so that it is many levels above the baseline. And then when you got a good source of PRP, a good solution of PRP, what you do with it is the next important step. Now, there are a lot of providers out there that are doing PRP now. If you went there with a knee problem, they'll say, okay, you have arthritis. They're going to take that PRP. Hopefully it's a good PRP. Now, if it's not a good one, then don't even go to the next step. But if it's a good PRP, they might just put one shot in your joint, in your knee, or your hip, or your shoulder, or your back, and say, that's your treatment. Let's see how you do, and we'll take it from there. Well, that's the big difference between a PRP done by many of the traditional docs that are out there, orthopedic docs, family docs, versus someone who does prolotherapy such as myself. So prolotherapy is essentially the godfather of regenerative medicine. It's been around since the 1950s, and it was around way before PRP and stem cells. And for all those decades, thousands and thousands and probably millions now of patients have gotten benefit from their various pains. And why is it so different than, say, just PRP? So PRP, again, is a solution, but prolotherapy is a technique. So the technique of prolotherapy addresses ligaments, tendons, and joints. So that may take a solution. The traditional solution for prolotherapy is dextrose. I could take dextrose and put it along all those, along ligaments, tendons, and into the joint of a knee, or the ligaments and tendons around your neck, your back, your shoulder, and put some solution that's going to start the regenerative process. Now, if that solution is PRP, and of course we're looking for a good quality PRP, then this is the same concept. We're looking at addressing the stability of the structure. So if the ligaments around your knee are loose, and you know that the knee feels unstable, well, just putting a shot in the joint's not going to answer the problem. You're going to need to work on the stabilizers, which is those ligaments. So with prolotherapy, we're working on those stabilizers. So if I'm going to do PRP solution, I'm going to do it with prolotherapy technique. So we're going to combine the best of the technique, which is prolotherapy, with the stronger solution, which is PRP. Now, dextrose has been working for decades and decades. It works great, but for some folks, they have more degeneration, more instability, and they need a stronger solution, so we go to PRP. But if regenerative treatment's done with prolotherapy technique, then you're going to do much better. You're going to get a better outcome, and it's going to last you a lot longer than that one shot in your joint. So when you're thinking about regenerative treatments, look for someone who does prolotherapy and PRP versus just someone who's doing PRP and stem cells and doesn't do prolotherapy, because you're not going to get that comprehensive treatment that's going to work on the stability of your area that's hurting. So if that makes sense and it's working for you, great. If not, if you've got any questions, leave them in the comments or call, and we'll be happy to answer some questions. All right, take care.